Hi, my name is Josephine, and today I will be talking to you about post-traumatic nightmares. Before I present post-traumatic nightmares, I will begin by discussing nightmares themselves. Nightmares are a type of dream that invoke significant feelings of stress and fear within the individual having them. Nightmares typically awaken the individual from REM sleep. However, sleep tests have shown that nightmares can occur during non-REM sleep as well. Nightmares may appear real to the dreamer while sleeping, and once awoken, the individual may struggle to understand that what they experienced was not in fact real. Post-traumatic stress disorder, also known as PTSD, is a mental health disorder emerging from psychological trauma rooted in the experience of intense fear along with real or perceived danger to self and/or others. Symptoms of PTSD include, but are not limited to, distress when exposed to memory triggers being stimuli in the environment that remind the traumatized individual of their traumatic experience, purposeful avoidance of memory triggers, re-experiencing of trauma in the form of flashbacks and/or nightmares, and general sleep disturbance. I will now discuss the main topic of my presentation, being post-traumatic nightmares, also referred to as PTNs, and also referred to as trauma-related nightmares. PTNs are a common experience for individuals who have been through trauma. Around 90% of people exposed to trauma will experience nightmares as often as 6 nights a week. Post-traumatic nightmares can be diagnosed as a symptom of post-traumatic stress disorder or as part of a nightmare disorder. Replicative nightmares, where the traumatized individual relives their traumatic experience while asleep, are the most extreme and pathological type of post-traumatic nightmare. The neurobiological relationship between PTSD and nightmares remains largely unknown. However, the topic was investigated in a study conducted by Nardo and colleagues, where they made use of neuroimaging techniques to investigate variations in brain structures associated with sleep disturbances in individuals suffering from PTSD compared to controls. What their study found was that sleep disturbances were associated with a loss of brain volume, or gray matter volume, within brain areas associated with REM sleep, along with brain regions tied to emotional regulation and memory. What these results suggest is a possible link between changes in PTSD-sensitive brain regions and sleep disturbance. The most widely used pharmacological agent for treating post-traumatic nightmares is called prazosin. However, the efficacy of this default treatment was questioned in a randomized control trial conducted by Raskind and colleagues. In their study, 304 military veterans were randomly assigned to either a placebo treatment group or to a prazosin treatment group. After 10 weeks, the researchers observed no significant differences between groups in terms of sleep quality and distressing dreams. These results put into question the efficacy of prazosin as a treatment option. Another pharmacological agent used for treating post-traumatic nightmares is called nabilone, and it is a synthetic cannabinoid. Nabilone is a promising treatment option in Canada, however, a prescription is not yet accessible in the United States. Imagery rehearsal therapy, also known as IRT, is the most widely studied non-pharmacological treatment for post-traumatic nightmares. In an IRT session, the patient is first educated about PTSD, sleep, and nightmares. Next, the patient identifies the post-traumatic nightmare that is causing them distress. They then change the narrative during wakefulness of this nightmare to one that they find less distressing. And lastly, they rehearse this new, less distressing narrative. The goal of IRT is to minimize exposure to traumatic dream content. Controlled studies show that IRT significantly reduces post-traumatic nightmares in individuals suffering from PTSD. IRT is also being explored in the context of art therapy, where the post-traumatic nightmare is re-scripted using artistic methods rather than verbal ones. Imagery rehearsal-based art therapy is helpful for accessing traumatic experiences stored in the patient's memory in a nonverbal manner. Another non-pharmacological treatment option for post-traumatic nightmares is called exposure, relaxation, and rescripting therapy, also known as ERRT. An ERRT session begins with the patient being educated about sleep, nightmares, and trauma, similarly to the IRT session, Next, the patient is intentionally exposed to the content of the nightmare. And last, the patient re-scripts the nightmare content into something they find less distressing. The key difference between ERRT and IRT is that IRT aims to minimize the patient's exposure to traumatic dream content, whereas ERRT intentionally exposes the patient to their traumatic dream content. Here is my list of references, and thank you for listening.